So Kaplan yang kedua is regarding problem with hyperglycemia due to uncontrollable diet intake without proper supervision at home. So objective data is random blood sugar level 7.6 to 8. Only take oral anti-hyperglycemic control tablet and there's no insulin. Subjective data is fatigue, daytime, and weak hand. Nursing diagnosis is hyperglycemia related to diabetes mellitus disease progress with uncontrolled diabetic diet. Scientific explanation about this diagnosis, it was type 2 diabetes because not involved insulin administration. Pancreas still functioning to produce little insulin only, which was not sufficient. If high blood glucose concentration each time after eating not well treated, it may cause serious complication toward multiple organ system failure in long term. If affected at eyes, may cause blind. If nerve, limbs may have necrotic tissue, which may need amputation. Kidney or blood vessel damage with bad prognosis if worsening. So the planning is patient will participate to maintain random blood sugar level to pre-diabetes level using prescribed medication list at home. Patient will be able to control body mass index through weight management, nutritional support at home. Patient will understand the importance of diabetic food care with sign of neuropathy. If hypoglycemic persists, patient will be able to prepare accurate blood sugar monitoring kit and learn how to use it. For intervention, to reduce patient on pathophysiology of diabetes by its definition, normal blood glucose ranges and targeted blood glucose level on each diet intake. The rationale is patient can identify hyperglycemia sign and symptom for immediate treatment and prevention of complication. Intervention yang kedua, prepare each meal with calories count to subtract 500 to 1,000 calories from daily total calories intake. So yang ni melalui formulary lah. Is for better long-term approach to promote a safe and gradual weight loss, distribute calories into carbohydrate, protein and fat may reduce spike of blood sugar level. That's the rationale. Intervention yang ketiga, check and monitor blood sugar level every day to avoid exceed 14 millimole per liter. The rationale is it may present in the urine with other hyperglycemic complications such as retinopathy, sensory motor neuropathy, cardiovascular disease. Intervention yang keempat, monitor the vital signs 6 hourly. Intake and output volume for tachycardia and imbalanced potassium level during hypoglycemia. The rationale is hypoglycemia causes hyperosmolarity and neurologic changes. It may trigger imbalanced serum potassium level, which may causes harm to the heart arrhythmias. Intervention yang kelima, advise patient to take special diet for pancreas to improve this organ with digestive system, special vegetables, fruits, mushroom for diabetes diet. Rationale dia, hyperglycemia can cause pancreas insufficient alpha amylase and alpha lipase enzyme. So kegunaan dia kita kena pastikan menu tu sesuai untuk membantu pancreas berfungsi dengan baik. So evaluation, patient able to limit her high fat food such as organ meats, fried food including fries and potato chips, oily sauce, ice cream, full fat dairy, cookies, pastries and cakes at home. Patient can maintain her weight control safely. Patient can maintain food intake with rice, bread and pasta. Patient able to participate with measure intake and output volume for accurate monitoring at home. Patient can maintain daily random blood sugar check at normal range. Well controlled with oral anti-hypoglycemic agent. Patient is active on activities at home without mood swinging. Nursing documentation yang ketiga melibatkan masalah hypoxemia due to inadequate gas exchange after rigorous activities at home. Objective data, tracheostomy wound dressing healthy, not in redness, no respiratory distress, SpO2 90 to 91%, stable blood pressure, systolic 100 to 130 mm mercury and diastolic 70 to 90 mm mercury. Subjective data is feeling lethargic, uncomfortable due to numbness fingers. Nursing diagnosis, risk of hypoxemia due to inadequate gas exchange related with history of bilateral lung atelectasis. So scientific explanation about this gas exchange impact occurred if dead space in the alveoli decrease is ventilation and perfusion. Patient cannot receive more oxygenation from each breathing circulation from the lung. It means some part of the alveoli has collapsed, could be due to pneumonia, pulmonary edema, atelectasis or acute respiratory distress syndrome. As a result, insufficient oxygenated blood reduce the body hemoglobin level. It may affect at total volume of gas exchange in the lung and also of atelectasis. So we plan patient will use oxygen monitoring device each time she had uncomfortable feeling while move around at home. Patient will be able to manage her breathing with better depth and rhythm during rapid respiration and tachycardic condition after each activities at home. Patient will gain back her saturation oxygen after activities above 92% all the time for tissue to receive enough oxygen. Patient will gain back hemoglobin level because anemia cannot improve oxygenated tissue perfusion. So intervention ada 3 untuk pesakit ni to check and monitor venous oxygen saturation each time patient had breathing discomfort after each activities or at rest. Number 2 is to titrate oxygen usage at home according to oxyhemoglobin response level to exercise. And number 3 is to check breathing effort through lung auscultation when patient is not stable. The respiration rate and breathing depth is to monitor closely every 15 minutes to 30 minutes until stable. So rationale for all these 3 interventions, it will reflect on the balance between amount of oxygen used by the tissue and organ and the amount of oxygen returned to the right side of the heart in the blood. Sometimes sleep also can cause apnea and hypoxia. Quality of oxygen supplementation may improve timely oxyhemoglobin saturation if patients stop pauses breathing while on activities. The risk of hemodynamic instability at home may require close monitoring if not revert, and it must bring to the nearest hospital immediately if low cardiac output. A limitation of lung to fully expand diaphragm, important to measure the total volume given above the functional residual capacity. If not normal, the diaphragm will not recoil with chest wall elastic pressures. Patient could be in distress with abnormal distensions after overuse of abdominal pressure to take the breathing. So evaluation, patient use bed oxygen portable at home while having mild breathing difficulty after her house course activities as routine backup treatment at home. Patient able to maintain SpO2 level above 92% after each home living activities without dyspnea. There's no respiratory distress episode with portable oxygen supply to support her breathing effectiveness with titrations of low oxygen concentration usage. Mental state condition improved at home. Patient was not confused, less fatigued with controlled activities, daily living, and provide support for home setting. No respiratory difficulty due to alveolar atelectasis or could be alveolar infiltrate. Evidence from previous radiology report finding. Patient did not refuse any prescribed medication by doctor at home, especially bronchodilators, medical treatment. So last, nursing documentation. Yang perlu saya highlight dekat Tuan Daim is the problem regarding risk of fall related to bilateral hand contracture with neurological condition at home. Objective data, heart rate above 100 beat per minute on each activities. Glasgow Coma Scale score 15/15. Subjective data, felt giddiness each time with fast heart beating, feeling lethargy uncomfortable due to numbness of the fingers. Nursing diagnosis, risk of fall related to neurological condition with the weak peripheral muscles. Scientific explanation, weak muscles among elderly was factors trigger fall incident at home. Only muscle strength, flexibility, and endurance will prevent risk of fall, but the changes occur in visual function, impact color perception, change in centers of gravity, unsteady gait, decreased muscle strength, decreased endurance, altered depth perception, delay response, and reaction time always increase incidence of fall and other injuries among any elderly with age-related physical changes. So we plan the patient with sensory deficit need hearing and visual support surrounding their living environment. Patient with a balance and gait problem must continue living with additional daily of living support when they likely to fall at home if fatigue or use psychotropic drugs. Patient should recover from hypotension, peripheral edema, dizziness, fatigue, weakness to prevent from fall. Patient with risk of fall need guideline to reduce injuries at home. So intervention ada 6 untuk situasi begini. Firstly, to get history of recent fall, medication, psychological and cognitive status of the patient at home. The rationale is to judge and protect patient from falling and other injuries risk factor. Number 2, to use checklist to verify risk factor of fall status at home. The risk can be measured as rational through such situation include version, mobility function, transfer behavior, nutrition, continence, environment, and activities of living. Intervention yang ketiga is to keep the bed closer to the floor and floor safe with marking system. The rationale is it may shorten the distance for a patient to fall from moving out of bed, reduce trauma and injury. Intervention yang keempat is to provide visual aid for the patient if patient have visual impairment. The rationale is orientation to living environment can reduce risk of fall with clear vision and hearing support. Intervention yang kelima is to provide hand exercise for patient to perform at home. And rationale is to stimulate contracture hand after neurological deficit with guide from professional team to assist. Intervention yang keenam to place furniture and equipment at specific area for patient to easily ambulate around in the house and assign someone to assist. The rationale is to prevent patient from accidentally pulling down object onto her body. So evaluation from this discussion, patient medication usage adjustable to reduce risk of fall due to drug interaction disturbing patient daily life activities at home. Patient able to coordinate her rest time more than daily activities of living also had reduced tachycardia episode and musculoskeletal pain which may trigger risk of fall. Patient home living lighting and had improved together with wet floor and other surfaces to reduce risk of fall due to slippery floors condition. Patient will climb stairs with assistance only. She used ground floor room temporarily and patient water sign with conscious level were stable each time after done nursing assessment. No deficit of conscious state which trigger risk of fall from the checklist finding. So ini untuk pemerhatian Tuan Daim sebab saya rasa staff yang akan pergi ke sana akan datang memerlukan dokumentasi daripada sesi home visit kita kali ini dan sangat penting untuk mereka prepare untuk new assessment checklist yang sesuai untuk pesakit akan datang. Itu saja daripada saya untuk laporan kali ini. Terima kasih Tuan Daim sebab meluangkan masa bersama saya sebab kita kena berbincang untuk your next management steps. Itu saja.
Okay.
Thank you.
Thank you sebab awak explain kat saya semua benda ni. And then it's okay, nanti saya akan bincang dengan anak pesakit lah untuk second visit tu nanti.
Okay, baik Tuan. Kita bersurai di sini.
Baik.
Okay. Bye-bye. Terima kasih.
Sama-sama.